and I'm here today to talk about the findings from the 2019 Canberra Gay Community Periodic Survey and also trends over time. For those of you unfamiliar with the survey, it began in 20 years ago, in 2000, which probably makes a number of us feel a little bit aged at this point. And the survey's been fairly consistent in that we have recruited gay and bisexual men during the Spring Out Festival in the ACT, assisted by our friends and peers from the AIDS Action Council, now Meridian, in order to maximise participation at gay events and venues. We added online recruitment 5 years ago, which extends our reach through the ACT. The response rate is the participation rate among those who are approached is pretty high, above 75%. The Canberra survey is relatively small, reflecting the size of the territory, with around 200 to 400 participants each round. But actually, last year's round, due to a sterling effort from the council and the peer recruiters, supplemented by online recruitment led by us at the Centre for Social Research and Health, we've got the largest sample we've had so far, with over 550 men. And so that's really, really heartening to see. Bearing in mind, of course, that we're now talking about results from the end of last year, and in between we've had a whole global pandemic emerge. So it's kind of quite interesting presenting this, that I thought we would just be concentrating on the dramatic changes in HIV prevention that we've seen over the last few years, but now I guess we might have some questions about what might happen in the intervening period. All the results of the surveys are made available in reports which we publish on our website. I've included the link here, and when we share the recording, we may also make the slides available through our ACT partners. So if you haven't already seen the report, you can refer to it. We produce these as sort of a reference point so people can see many of the key indicators we collect in the surveys. For the uninitiated, the surveys are pretty old school on the ground. They're a 4 A4 page paper and pencil survey on key practices and behaviours related to HIV testing, prevention, treatment, drug use and sexual health, and the participants' relationships with men. And we've asked a number of the core indicators for many, many years, which allows us to see the effect of local and national programs on gay and bisexual men's behaviour, but also trends that are emerging. And I'm just going to give you a sort of a selection of those indicators in this presentation. Excuse me, I'm like flicking between multiple screens here. Just a reminder of the survey profile. It's a very much what we would regard as a sort of a gay community focused sample. Most of the sample is in the most recent round was Australian born, high level of university education. That's fairly typical, I think, for gay community samples, but also for the ACT. High degree of full-time employment when we did the survey at the end of last year. Most of the sample are gay identified, although that has been falling slightly over time, and the proportion who identified as bisexual has been going up. And most of the men, most of the participants are classified as cisgender men, so male gender at birth, and they identify as male now. And there's a small proportion of transgender and non-binary participants. 3% of the sample were Aboriginal or Torres Strait Islanders, and that's stable over time. Okay, so I'm characterising the main presentation. I've been doing this in most of the participating jurisdictions around the country around the changes we've seen as PrEP use, a new form of biomedical HIV prevention, has been introduced. And this slide, which normally I would have placed towards the end of the presentation, I think illustrates the degree of change that we've seen, particularly in the last 5 years. The lines at the top are awareness of two different strategies. In orange is awareness of post-exposure prophylaxis. That's an emergency course of antiretroviral drugs to prevent HIV acquisition after suspected exposure to HIV. And you can see that awareness of PrEP has been variable, but has gradually increased over time with a sharp increase in the last few years. And in red, you can see awareness of PrEP. That's pre-exposure prophylaxis. So that's regularly taking antiretroviral drugs to prevent HIV acquisition. And you can see that that's increased from a low base in 2015, with about 40% of the sample having heard of PrEP, to nearly everyone in the sample having heard of PrEP in the most recent round. The lines towards the bottom of the graph in purple and green show use of these strategies, and you can see the big change there is the sharp increase in PrEP use between the last two survey rounds. So with over a third of non-HIV positive men reporting PrEP use in the 2019 survey. And I know that interstate comparisons are often interesting for people, particularly when your local jurisdiction looks good. And so I thought I'd include this because you'd be pleased by it, because in the 2019 surveys that we did last year, so there were 5 jurisdictions, Canberra had the highest level of PrEP use recorded nationally. But bearing in mind, this also reflects the time of the year in which the surveys were done. So Canberra and Perth were done towards the end of the year, whereas Sydney and Melbourne had done it at the beginning of the year. But still, it's a very dramatic increase. And many of the other indicators I'll show you, the changes we've seen in the last few years appear to be connected in particular to rising levels of PrEP use. Okay, so moving to some of the legacy indicators in the survey, we ask everybody if they've been tested for HIV, but also how recently they've been tested and how often they go for HIV testing. This shows you 2 of the legacy indicators at the top, the proportion of the sample who say they've ever had an HIV test in orange. And you can see it's been relatively stable, but in the last 5 years, we've had a bit of an increase with now over 9 out of 10 of the samples say they've ever had an HIV test. And in blue is excluding HIV positive men, so men who we'd expect perhaps to go more regularly for testing. You can see the proportion of non-positive men who have been tested in the previous year. Again, it's improved quite dramatically over time, but in the last 5 years, we've seen a bigger increase with now over 3/4 of the sample saying they've been tested in the previous year. However, those of you involved in sexual health will know that during this long period that I'm showing you here, nearly 20 years, the guidelines for testing for gay and bisexual men have changed a number of times. And actually in the most recent period, most sexually active gay and bisexual men are recommended to test 3 or 4 times a year. So I'll show you frequency of testing now. So we asked men how many HIV tests they've had in the previous 12 months. And this shows you the number of tests per year reported by non-positive men in the sample. And you can see on the surface, this looks like a big improvement. So in the yellow at the top of the graph, you can see the proportion who are reporting 3 or more tests per year, which is broadly in line with the guidelines. And there's been a big increase there in the Canberra survey, with now over a third of the sample reporting that quarterly testing. However, it has been noted in Canberra and elsewhere that this is probably very heavily tied to PrEP use, and certainly our analyses suggest that is the case. And this picture, this change is almost certainly highly concentrated among PrEP users. So most of you will know that if somebody's using PrEP daily, they have to come back to the doctor every quarter in order to get a new script, but also at that point they're recommended to have a full HIV and STI screen. And so we think this change in frequency of testing is largely driven by PrEP rollout. That's emphasised when we report this indicator and exclude PrEP users, which I'll show you now. So this is the same indicator, number of tests per year, but leaving out PrEP users, and you can see the proportion of men reporting quarterly testing has not really changed at all. And there's actually still quite a large proportion of men who have not had any HIV tests in the previous year. Now, bearing in mind that PrEP users tend to be more more sexually active and report less condom use than their peers. So some of these men in here would not be indicated for frequent testing, but obviously there is still a group of men in here who are at risk of HIV. And so this might be something to think about in terms of targeting testing, about sustaining testing or increasing testing levels among men at risk who aren't using PrEP. I'll give you another interstate comparison next. So this is looking at the legacy testing indicators, whether men have ever been tested for HIV in blue and whether men have tested in the previous year in orange. Canberra is on the far right-hand side. And I've put most of the other participating jurisdictions here. You can see that Canberra's level of lifetime testing is the highest in the country. And the level of testing in the previous 12 months is similar to the eastern jurisdictions, particularly Victoria, New South Wales and Queensland, which is good. This is just reminding us of the results of testing and the profile, the HIV status profile in the Canberra survey and for men in the ACT. As you would expect, the majority of men in the survey report that their HIV status is HIV negative. That's in green. There's a small proportion who are diagnosed with HIV, fewer than 1 in 10. You can see them in blue. A similar size group who say they've never been tested, that's in orange. And a very small group who have been tested but don't know their results. And this is a fairly standard profile in the periodic surveys across the country. We should note, however, because of the small relatively small sample size in Canberra most years, there's usually a very small group of HIV positive men. So I will show you one main indicator for positive men next, but then it's not really possible for us to stratify the sample by positive and negative because of the small number of positive men in the sample, apart from slightly better in the 2019 round. If we can sustain that, we'll be able to do some more analyses looking at positive men in the territory. So this is looking at HIV positive men, noting that they're a relatively small group in the previous rounds. This is showing you the level of treatment uptake in green, and you can see that that's gradually increased from 80% nearly 10 years ago to nearly everybody, all the positive men in the sample in the most recent round. And that's in line with what we see in other jurisdictions as well, gradually increasing levels of treatment uptake among positive men. In orange is the proportion of those men who have achieved viral suppression and undetectable viral load, which you know is a marker of treatment success and arresting deleterious effects of HIV infection, but also means that these men cannot pass on HIV infection during sex. And you can see there that there's high and sustained levels of undetectable viral load over time. Okay, so moving on to some of the relationship and sex indicators. We make a distinction in the survey between casual and regular male partners. We don't ask about other partners, which is a weakness in the surveys, like female partners or non-binary identified partners. But traditionally we have focused on the highest risk practices for HIV transmission, which in Australia has traditionally been sex between men. So we asked men who they're having sex with at the time of the survey. You can see there's around just over 1 in 10 in blue who say they're not sexually active at the time of the survey. In orange, a fifth of the sample say they're just having casual sex. And then the other two groups, the yellow and the grey, are men who say they're in relationships. So we have in yellow men who say they're in a monogamous relationship, they have one main partner. And in grey, the largest group, men who say they have regular and casual partners. So we would classify them as being in an open relationship or having a number of regular male partners. And that group, the open relationship group, is the one that's grown in the last few years, which may be related to PrEP use. The main thing to note here is that the majority of the sample have regular partners, and the majority of the sample have casual partners as well, and these two groups overlap. Okay, so let's look at the sex that the men report with these different partner groups. So this is with regular male partners, which other research we've done suggests that for most of the men in the survey means a boyfriend or a husband or a similar type partner. You can see here that the majority of men with regular partners don't use condoms with those partners for anal sex, and that has increased a bit. This is fairly typical. This is similar to what you would see in a heterosexual population as well. As condomless sex has become more common in the last few years, that may be tied to PrEP use. Consistent condom use with regular male partners in blue has declined and is only reported by a small group of men with regular partners now. And there's also a group of men with regular partners who avoid anal intercourse with their partners, around 1 in 5. That's relatively stable over time. This pattern is fairly typical across the country. Let's look at the same indicator with casual partners. Now you can see here, historically, gay and bisexual men used to use condoms at fairly high levels with casual partners. That was the primary prevention strategy. But obviously in this period, the choices available for prevention have changed. And so you can see here the group of men reporting condomless sex with casual partners, which historically was the highest risk practice for HIV transmission in Australia, has increased very dramatically. Condom use has declined, and the group of men avoiding anal intercourse with their casual partners has also dropped. Now, we recognise that this can sometimes look a bit alarming to people in the context of, if condoms were the only prevention strategy available to people, this would look like something was going wrong. But we know that isn't the case anymore. And so we've developed an alternative indicator which reflects biomedical prevention strategies. So I've mentioned PrEP already, and I've also mentioned viral suppression to avoid onward transmission, sometimes referred to as U equals U, undetectable equals untransmittable. And this indicator tries to take account of those strategies used by participants. So to take you through this, we've got some of the same indicators as on the previous slide. We have men reporting no anal intercourse with their casual partners, men reporting consistent condom use with their casual partners. You can see that's fallen. Positive men with an undetectable viral load posing no risk to their partners in light blue, which has increased a little bit over time. The big change here is negative men on PrEP. And I should note that all of these groups in the light blue up are men who don't necessarily always use condoms with their casual partners, but we classify men who are undetectable or men on PrEP as safe. We classify that as safe sex. And then the groups where there may be a risk of transmission are these orange and red groups above here. So the orange group are positive men who have not achieved viral suppression or they're not on treatment. But they are a very vanishingly small group in the Canberra survey, particularly in the most recent period. And then men who may be at risk of HIV acquisition in red are negative and untested men. They're not on PrEP, but they do report sex without condoms. In the dark red are men who restrict themselves to being the insertive partner during condomless sex, which may offer some protection from risk of infection. And in the lighter red are negative and untested men who report condomless sex with their casual partners and receptive sex as well, which is usually regarded as the highest risk practice for transmission. And we should note here that other studies we've done, particularly on undiagnosed infections, suggest that these men pose a risk to each other because some of these men may have HIV and not know it, and therefore have a high viral load. What's heartening about this slide, and particularly reflecting on where we were 2 years ago, where we hadn't really seen much improvement in the level of safe sex, so that's all these categories up to the yellow group here, including PrEP. There was no real change in the level of protection in the community, and no reduction in the size of the men in red, this group who are susceptible to HIV. But you can see in the last 2 years the level of safe sex has actually improved a bit, and we now sort of regard all of these groups as offering prevention coverage or safe sex, and it increased to over 3/4 of the sample in the most recent round. So this is quite good, and in other jurisdictions we've seen this tied to reductions in HIV infections among gay and bisexual men. So I'd be interested to hear from some of you at the end whether that's also what you're observing in the territory. Okay, we don't just ask about biomedical prevention strategies in the survey, we ask about the range of things that men may do to reduce transmission risk, and these include some older strategies, and I'm going to show you those now for HIV negative men. So apologies for the range of strategies, but we've documented quite a lot of different strategies that men may use in order to minimise transmission risk. The one that stands out here, apologies, this is restricted to HIV negative men who've had condomless sex with casual partners in the last 6 months, because the group of positive men reporting this is too small. The blue line, which you can see is the most common strategy reported historically in the last 10 years, is serosorting, and this is negative men seeking out other men they believe to be negative and not using condoms with them, so matching HIV status. You can see that that was by far the most dominant strategy before the introduction of PrEP, and has declined a bit in use in the last couple of years. The big change here is the use of PrEP in yellow. You can see that now 2/3 of negative men who've had condomless sex with casual partners say they are on PrEP, and you can see that over half in the dotted yellow line say that their partners are on PrEP. So that's a really big change in the last couple of years. There are some other legacy strategies in here which are less effective and less commonly used. So strategic positioning for negative men, that's taking the insertive position during condomless sex, withdrawal before ejaculation, commonly reported by a variety of population groups, but not, it does reduce risk a little bit, but is not particularly effective. And another effective strategy in green, which is undetectable viral load, so having positive partners who are virally suppressed. You can, perhaps reflecting the fact that there are relatively few positive men in the territory, not that many negative men report the use of this strategy, although it has gone up a bit in the last couple of years. Okay. I've put in some other contextual indicators as well, which can sometimes be useful in trying to think about where we can engage gay and bisexual men or where they're thinking about sex. This is where all the participants in the survey report meeting male partners. And you can see that there are a number of changes. You can see the most common method, unsurprisingly, for those of you familiar with gay and bisexual men, is using mobile apps to meet partners, such as Grindr or Scruff. And you can see that that's really increased over the last 4 survey rounds, and is by far the most dominant method that men say that they've met their partners. Internet use, so this probably reflects using sort of a desktop-based or browser-based device. Less commonly reported, but still relatively frequently used. Gay bars, a small resurgence in the last round. And actually minorities of men reporting men that they've met at dance parties, beats, sex venues, that can include saunas and dry venues as well. And relatively over 1/5 of the sample saying that they've had sex while they've been travelling in Australia or while overseas, and the overseas group has increased over time. We ask, as I mentioned, we do ask about drug use in the sample, and I just included a few drugs here. We ask about a longer list than this. What's interesting is that overall we do see that levels of drug use in the Canberra sample have gone up over time, and there are kind of notable increases in the use of amyl or poppers in the last few years, which is interesting given the whole discussion about whether that poppers use would be regulated or restricted further, but there doesn't seem to be any effect of that in Canberra at the moment. And this is, for the uninitiated, is often used as a sex aid by gay and bisexual men to enhance pleasure during anal sex. The next most commonly used drug is cannabis. That's fairly, and this pattern is fairly similar in most jurisdictions around the country, although there are differences in drug availability and use across the country. Viagra use and the use of other erectile dysfunction medications has also gone up. The fact that amyl and Viagra have gone up, I think, might be tied to PrEP use. We'd have to look into that a bit more, but these are sex-related drugs, so that suggests their use is being driven by different sexual practices. Cocaine use has increased a little bit over the last few years and is reported by over 1 in 6 of the sample, which, when you think about it, is a very high level of use. And crystal use, which historically we've sometimes been a bit worried about in terms of people being at higher risk or not taking so much care for HIV prevention, is at a low and stable level. Okay, so in summary, the big change that we see in the most recent round is that PrEP use has jumped to 36% in 2019 and appears to be associated with increased HIV testing. I should mention, given our friends at the Sexual Health Centre and elsewhere, that it's also a very similar pattern for sexual health testing as well. So you see the same sort of changes in the last few years. Rising PrEP use is also associated with decreased condom use. And what we believe is an increased level of HIV prevention coverage in the sample, which may be useful for driving down notifications. The small number of HIV positive men in the sample report high levels of treatment uptake and viral suppression. Negative serosorting remains relatively stable in the sample. It'd be interesting to see if that changes further over time. Mobile app use is the dominant way that men meet their partners and continues to increase. And we've seen the recent increase in the use of sex-related drugs, particularly amyl and Viagra. And I'd just like to acknowledge everybody who makes the survey possible, particularly all the participants, our funders at ACT Health, and well, let me just go back, and the team at the AIDS Action Council in particular, particularly Lee and John, who helped organise the survey last round. Our contacts at ACT Health, Sarah Martin and her colleagues at the Canberra Sexual Health Centre, and my colleagues at UNSW, particularly the Centre for Social Research and Health and the Kirby Institute. And I'd like to acknowledge our core funding from the Australian Government Department of Health. Thank you. Now, how to do this? You can do this in 2 ways. I suggest that you can either unmute and ask a question, and I can also cycle back through the slides if you want to review something, or you can type a message. So I'd encourage you to be brave, or just pipe up. Greg, I can see you thinking about asking a question.
Thank you. Yeah, I have been thinking of a question. It was regarding the reduction strategies. You mentioned that you presenting the HIV negative results there because the positive cohort is so small.
Yeah.
Is there any news looking at a larger portion, say the recent Sydney, Melbourne, or even a national cohort of positive men?
Yes, so it's a good question, and thank you for reminding me. Yeah, so this pattern, so I'm showing you this one again, of risk reduction strategies used by negative men. In general, when we look at positive men, so if we look at them nationally, or if we look at them in some of the other more populous jurisdictions, you see quite a different profile. And it perhaps wouldn't surprise you to see that the big change among positive men, so positive men historically generally report serosorting, positive serosorting as their primary strategy, like 10 years ago. And the massive change as we've confirmed the science and then reassured people in the community that undetectable viral load is highly effective in preventing HIV transmission, there's been a big switch. And so what you see is positive serosorting has declined in frequency among positive men, and reliance on undetectable viral load has gone up. And the other change we've seen in the last 2 or 3 years is also positive men reporting more sex with men on PrEP as well. So those are sort of the three main changes for positive men: decline in reliance on serosorting or restricting condomless sex to positive partners, increasing reliance on undetectable viral load, and increasing sex with men on PrEP. Oh, and I can see a question from Meridian, the whole of Meridian, asking about the increase in bisexual identified men. Is this the same in the other states and territories? So, yeah, I can see Curtis nodding there. Yes, I believe so. What we tend to see, even though the surveys are very gay branded, and I think sometimes we get criticism about this, going, well, why haven't the surveys branded to be more inclusive of gender diversity and sexual diversity? One of the problems we have is if we change the survey branding too much and change the sample too much, then it becomes difficult for us to compare participants over time. But we are very conscious of this. Despite that, despite leaving the branding as is, we see in most jurisdictions a small but steady increase in the proportion of men identifying as bisexual or with other identities such as queer or pansexual and so on. And so even with the gay community sort of focus, we see an increase in the proportion of men saying that they're identifying as bi. We're not seeing such a big increase in gender diversity. But then again, yes, there's a criticism that a lot of the questions sort of implies as gender partners, although when we're asked to clarify that, we say anybody who identifies as male as a partner. But obviously that doesn't include everyone. And a follow-up question, is this a younger cohort? Yes, generally when we look, the bisexual men on average are younger men as well. Any further questions or comments? Any reflections from the council, Lee and the others, on the experience of doing the survey round this year? Well, last year, sorry.
Hi, Martin.
Hi.
Just in comment in relation to any reflections last year, we did have quite a few people from our trans non-binary community not associating well with the survey, and I think that's to kind of, and you mentioned that before, and the marketing stuff, but I think, I don't know, in the future that's something that we need to think about.
Yeah. Yes, look, it's a common response where not every single survey round, but most, we get some feedback on the ground about whether we could be more gender inclusive in terms of questioning. And then, of course, I think for those of us who've tracked the surveys over time, I think people understand that if we change the key sexual practice indicators, we wouldn't be able to report trends anymore. We would have to sort of do the analysis in a different way. I've been trying to work out other ways around this, whether we can develop a set of more inclusive surveys and for a number of different groups in parallel to the periodics, where we could perhaps then compare indicators across surveys that are designed to be more inclusive of different populations. So whether we could, I've worked with my colleagues at Kirby Institute on the trans and gender diverse sexual health survey, which we ran, I think the year before last, where of course there we were absolutely gender inclusive about partners. We've experimented with some of our surveys at UNSW, asking whether people have trans and gender diverse partners, and then asking sexual practice questions in a way that doesn't assume specific body parts and people taking different roles, which obviously the periodic survey does. historically. And the other group who we've mentioned, bisexual men, like there is an increasing focus in some, but not all jurisdictions about bisexual and heterosexual men who have sex with men. And I think there, if we were to take that seriously, we would actually have to start asking about female and gender diverse partners as well, in order to really capture who people are having sex with and where they might need support or advice, where risk may be occurring, which is traditionally how we're funded to look at these things. But yes, I understand. The other thing that we're thinking about is whether we reskin the survey. I don't know how this would work in the field, which would be around going through all the questions and work and removing things that are not inclusive, and changing the branding so that everybody could fill it in.